First of all, I'm the proud daughter of Mexican immigrants and migrant farm workers. I was a migrant farm worker as well. We migrated from a small little border town called Rio Grande City in the Rio Grande Valley here in Texas, all the way to Bakersfield, California every summer to pick grapes or anything in season. I see myself, I see my parents in them. Every time I see, a young girl picking crops, that was me a couple years ago. I wake up every day with the determination of being a champion for ag worker health and well-being. My name's Annabelle Rodriguez, and I'm an assistant professor in the Aegis department here at UT Health Houston School of Public Health. I also lead the small rural healthcare systems group as well as the food chain supply. The Texas Epidemic Public Health Institute is a new state agency that's headquartered under UT Health Houston. Basically, we're trying to all come together, whether it be health departments, academic institutions, different community-based organizations, different business industry partners, and we're trying to fill in the gaps of all the challenges that we saw during COVID to really strengthen the Texas economy, to strengthen the health and safety of Texans all across Texas, whether metropolitan areas or rural areas, to prepare for the next pandemic. We have two overarching goals. One is to really develop and disseminate and evaluate resource lists. And these resource lists were created in collaboration with the University of Texas El Paso to try to educate rural communities about these limited resources in the community. So really filling those gaps of where can you go get tested? Where can you seek treatment for COVID? We have anything from funeral assistance, childcare, free Wi-Fi, food pantries, winter clothing, translation services. And so all of these gaps that we were able to identify during COVID are those that we're trying to be filled with this working group. Involving the community-based organizations is paramount to anything that we're doing because they know their communities. They were there with their communities when COVID happened. They understand where the pits are. They understand where the community comes together. I think leveraging their interactions and their trust with the community is the most important. Little Bear Produce, or J&D Produce, is a produce company located in Edinburg, Texas, which is in the Rio Grande Valley. They sort anywhere between 23 types of leafy greens. So they have the farm operations in the Rio Grande Valley, and then they have their sorting and grading and packing house where they employ the majority of their workers. That gets shipped off, and then we see it in our grocery retailers. We started to do education on site for all of their workers. We started to do also vaccination clinics, not only for their workers, but also for their families, keeping in mind that in the Rio Grande Valley, there's a lot of what we call familismo, which is these multi-generational homes that live in one household. And we understand that health doesn't just start at the worker perspective, it's at the family level. So really doing that family-based approach was very successful for us. We had some resistance, but a lot of this resistance came from a point of fear from workers, of a point of unknown, right? Like, I don't know what's in the vaccine. So we took the time to not only train individually as a group, doing focus groups where we allowed everyone to ask questions, but we even did one-to-ones, and we did one-to-ones with families to make sure that we were able to meet workers exactly where they are. Another thing that we have been doing now is not only launching the TEFI resource list on site, but also working with the USDA and the National Center for Farm Worker Health to give the one-time relief payments for agricultural workers and their families. It makes a really big difference. And I can tell you just from experience of launching this and going out there to train the team, I probably did anywhere near 200, 300 applications by myself in that week. And one of the stories that really captivated me, and maybe captivated is not the correct word, it hit home to me of the reason that we woke up to do that work that day. This lady had just lost her daughter, a 24-year-old, to cancer, couldn't get her to Houston on time. This was 6 weeks prior to us doing her application, and she said, I finally have enough money to get her headstone. And it's things like this that I think are really important to me, especially, that we are helping those who feed us every day. Cost, the lack of health insurance, transportation, language challenges, childcare, long working hours, fear of law and deportation agencies, all of those were fears that we had every single day. And you carry those traumas with you, and you carry that weight on your back every single day. And I know how it feels firsthand. And so this is why I'm so passionate about trying to remove these barriers one at a time from these families, because it's necessary. And I think it's a win-win for everyone, that all our citizens in Texas are healthy and, they're prepared for whatever is to come.